Good day, everyone. I'm Rumana Hawk from ARK Foundation. I will briefly present, is the urban primary healthcare system in Bangladesh ready to manage non-communicable diseases? Bangladesh is a country with 166 million population. Population density is also very high, and there is rapid urbanization going on in Bangladesh. With most of the people living in urban areas in Bangladesh, it's expected to become an urban country by the year 2039. If we look into the non-communicable disease risk factor prevalence in urban and rural areas, we can see that in all the indicators, urban areas is lagging behind than rural areas. For example, alcohol consumption, insufficient physical activity, processed food intake, overweight and obesity, urban areas is performing low compared to the rural areas. The primary healthcare service provision between urban and rural areas varies. Ministry of Health and Family Welfare is responsible to provide primary health care in rural areas. In urban areas, Ministry of Local Government, through the contracted NGO clinics, provide primary health care to urban population. Ministry of Health and Family Welfare also runs government outdoor dispensaries in urban areas. They also run outpatient department in the tertiary hospitals. Against this background, our research aimed to identify the gaps within the urban primary healthcare system in managing non-communicable diseases in accordance with WHO health system building blocks. We analyzed secondary data. We also conducted scoping review, and we conducted key informant interviews and in-depth interviews with key stakeholders. The preliminary findings of the study shows that urban primary healthcare facilities are primarily focused on maternal and child healthcare and sexual and reproductive health. 15% of urban primary healthcare facilities do not provide any NCD care at all, and NCD guidelines were only available at 30% of the urban primary healthcare centers. More than 80% of the urban primary healthcare facilities have workforce responsible for managing NCDs. Workforce from 18% of the centers reported receiving training on cardiovascular disease within the last 2 years, while workforce from 41% centers received training on diabetes mellitus within the last 2 years. 50% of urban primary healthcare facilities had no NCD medications, and 41% of the centers had hypertensive medications. 3% of the facilities had diabetic medications. There is lack of a separate allocation from budget for non-communicable diseases within the local government. Budget allocated to Ministry of Local Government are usually spent on other priorities such as infrastructure development and dengue malaria control. If we look into the absence of a separate NCD record keeping and individual patient record keeping mechanism in urban areas, we can see that the information are not transferred to the dashboard of and the database managed by the Ministry of Health and Family Welfare. There is also lack of coordination between the Ministry of Health and Ministry of Local Government. The Health Management Information System managed by the Ministry of Health and Family Welfare, known as DHIS2, captures data on non-communicable disease, but only on 2 diseases, diabetes and hypertension. Unfortunately, the data from the urban primary healthcare centers are not captured by this DHIS2. If we look into the availability of drugs, health workforce training, guidelines availability, laboratory facilities, and health workforce availability and equipment availability across these urban primary healthcare centers, we can see that only 7% of the centers had availability of drugs, and whereas only 61% centers had availability of equipment. So all these centers lack the essential drugs and health workforce and guidelines. In summary, we can say that there is infrastructure and human resources in urban primary healthcare centers, but there still needs supply side readiness, for example, training of the staff and providing medicines and equipment. There also needs further research to explore the patient and community expectations from these healthcare centers. And it is really important to have political commitment to strengthen the urban primary healthcare system to integrate non-communicable disease management within the urban primary healthcare system. Thank you, everyone.